All right, now let's discuss this further. We're now joined via Zoom by Executive Director at Childsafe, Zaytoon Rabaney. Zaytoon, thank you so much for your time this afternoon. Now, this project, the JTTC, seems like a very good initiative, and one wonders why it wasn't started before. But talk to us about this initiative and how bad the problem was actually for these children to get to their schools.
Unati, thank you for this opportunity. You know, Childsafe South Africa is a child injury prevention unit based at the Red Cross Children's Hospital. And the intervention that we focus on is to try and prevent childhood injuries. The national statistics that we have indicates that 40% of fatalities nationally are pedestrians that's involved in road crashes. So that gives us about 1,300 children who dies on our roads annually. That includes passengers as well as pedestrians. And roughly that speaks to us around 108 pedestrians, children that die on our roads monthly. So this program it's a pilot project that is funded by the FIA Foundation, and the objectives and the focus areas really is around the vulnerability of pedestrians, the focus on high-risk roads in terms of pedestrian usage, walking safely to school, and also to create safer school zones for our children as they are the pedestrians. So the Walking Safely to School program, currently it's in its second year, and it focuses on 6 primary schools in the Khayelitsha area. And the main outputs of it is, as you've seen now through the JTTC as a tool, it's on environmental education. But it's not just the JTTC that was launched. Prior to that, there were interventions of road safety education, and we work very closely with the Western Cape Government of Road Safety, the City of Cape Town Traffic Services as well, to help with road safety education right there at the school. The teachers were also involved with lessons on road safety education, and they were provided with resources to reinforce. And the JTTC at the school pulls it all together as the physical tool that's there to reinforce. As we know, children learn by reinforcement. The other focus areas is a very important one. We heard the speech earlier in talking, TG, where the ANC media conference talked about that, people are complaining about poverty, unemployment, and roads. It made me happy when he mentioned the word roads. And also the question that was asked, what is the plan for the ANC? We need to transform this country. We need to transform society. So collectively, we also need to try and, transform our roads and create better, safer school zones for our school. The environmental modifications are very important. These involve the road signs, the speed bumps, raised traffic, all traffic calming mechanisms, and in some instances, even the pavements for our learners to walk safely to school.
Zaytoon,
and then the big focus is also...
Zaytoon, if I can come in there. So the Junior Traffic Training Center, which is what you're calling the JTTC. So it's been launched at the one school. There's 6 schools involved. So I would imagine it's going to be rolled out across all the schools. Talk to me about other areas that you're looking at, as your organization, as well as the departments of transport that you probably have approached. I'm sure this issue is much bigger than just that specific area, Khayelitsha.
No, indeed it is. It is a much bigger issue. And we've started an intervention where we tried at a national level. We had support from one of the big corporates in the motor industry in the Tshwane region. We are just finalizing the environmental modifications there, where we only focused on 6 schools. But then, yes, the JTTC junior training traffic centers will be rolled out at all the other schools that we are working with in the Khayelitsha area. And we have managed as Childsafe to secure funding from UNICEF for further implementation and expansion of this pilot program. And we're moving to the Stellenbosch arterial road here within the Cape Town region, focusing on schools in the Belhar and the Delft communities. And what we are doing with this intervention, we're starting now, the implementation period is starting now from July onwards for 2 years. We will also be including at least some of the high schools as well, and not just a focus on the primary school, because that was one of the needs that were mentioned by the schools in the Khayelitsha area. So definitely we're moving along into the Stellenbosch arterial road with Belhar and the Delft areas. And obviously what is important, all of these interventions are funding dependent. So we make applications for funding, we put these together, and we are also informed by all of our partners, the Road Traffic Management Corporation as well, to focus on the hotspot areas where our pedestrians are most at risk. So we're hoping to move forward in the Delft Belhar region, and who knows where we are going to land, Unati.
I hope
this is a pilot. Yeah, this is a pilot, and it's definitely creating a blueprint for us to roll this out and upscale this at the provincial level, and who knows, hopefully at the national level as well, with all other partners also coming on board.
Fantastic. It will absolutely not only be a convenience for those school children, but also save lives. Zaytoon, thank you so much for coming on. Really do appreciate your time. Zaytoon Rabaney there from Childsafe, and she's the executive director there.